In today's session, we're going to dive deep into the basics of how we diagnose and monitor a pregnancy. We'll cover everything right from taking a good history to tracking the baby's growth. So, let's get started.
Here's our roadmap for today. We'll start with the Obstetrics score, then discuss the 3 types of pregnancy signs. After that, we'll look at clues in the first, second, and third trimesters, and we'll wrap up by learning how to track uterine growth.
All right, first things first. Let's talk about the Obstetrics score. This is the absolute first step you have to take when a patient comes to you. You can think of it as the basic language of obstetrics, and mastering this is completely non-negotiable.
Now, the score has 2 key parts, gravida and parity. Gravida is quite simple. It's just the total number of times a woman has been pregnant. And please remember, you must include the current pregnancy in this count. Parity, on the other hand, is different. It only counts the previous pregnancies that have gone past 28 weeks, which is our period of viability here in India. The most crucial point to remember is this: parity does not include the present pregnancy.
So if you want to get a really detailed history, the best way is to use the GT-PALE system. Let's just break it down. G is for gravida, which we just covered. T is for term deliveries, pregnancies that made it to 37 weeks or more. P is for preterm, which is from 20 to 36 weeks. A stands for abortions, meaning pregnancies that were lost at or before 20 weeks. And finally, L is for the number of living children. It's a very neat and systematic way to get the whole story.
Now here's a very common point of confusion. What if the patient had twins or triplets? See, you have to remember, a twin pregnancy is still one single pregnancy event. So for gravida and parity, you will count it as 1. But for L, the number of living children, you count the actual number of babies. So if she delivered healthy twins, L would be 2. Simple, isn't it?
Okay, let's move on to our next section. We've taken the history, now it's time to examine the patient. The clinical signs of pregnancy, they're beautifully categorized into 3 types based on how sure they make us about the diagnosis. We have presumptive, probable, and definitive signs.
And the concept is really very simple. Presumptive signs are what the patient herself feels and tells you about. Probable signs are what you, the examiner, can actually find during a clinical examination. And definitive signs? These are 100% diagnostic of pregnancy. They leave absolutely no room for doubt.
Okay, let's now zoom in on the first trimester. This is usually when we first suspect a pregnancy. And the examination findings here are very subtle, but they are classic.
So the patient will typically come to you with these kinds of symptoms. Amenorrhea or missed periods, that's the most common one. Then you have morning sickness, a feeling of needing to urinate more often, some breast tenderness, and a bit later on, quickening. That's the very first feeling of the baby moving. Now these are all presumptive because other conditions can cause them too. They suggest pregnancy, but they don't prove it.
Now, what do we find on examination? These are the probable signs. At around 6 weeks, you can feel a softening of the cervix. That's called the Goodell sign. By 8 weeks, because of all the increased blood flow, the cervix and vagina get a sort of bluish tint, which we call the Chadwick sign. And then there are others, Osiander, Piscacek, Palmer, and the very important Hegar sign. All of these are objective findings, but still, they are not 100% definitive.
Let's just take a closer look at Hagar sign. This is usually seen between 6 to 10 weeks. It's a bimanual examination. As you can see in this diagram, you place 2 fingers in the vaginal fornix and your other hand on the abdomen. The uterine isthmus, that's the part between the cervix and the body of the uterus. It becomes so incredibly soft that it almost feels empty. Your fingers feel like they could meet. This is a very classic probable sign.
You know, in these early weeks, before we can properly measure from the outside, we often estimate the gestational age by comparing the uterine size to common fruits. It's a handy trick. At 6 to 8 weeks, it's about the size of a pear. This grows to the size of an orange by 8 to 10 weeks, and by 12 weeks, it's like a grapefruit, just big enough to be felt above the pubic bone.
All right, moving on into the second and third trimesters. The signs we see now become much more conclusive, and our focus starts to shift from just diagnosing to also monitoring how the pregnancy is progressing.
A key sign that appears now is called balliment. It's like, imagine tapping an ice cube in a glass of water. It moves away and then it floats back. Internally, around 16 weeks, you can give a little tap to the fetal head with your finger during a vaginal exam, and you'll feel it bounce back. externally, from 20 weeks onwards, you can do this same thing through the abdomen. It's a very strong indicator of a fetus floating around in amniotic fluid.
And now we've finally come to the definitive signs, the ones that confirm pregnancy with 100% certainty. Hearing the fetal heart sound, whether you use a Doppler at 10 weeks or a stethoscope by 20 weeks, is definitive. Seeing the cardiac activity on an ultrasound, absolutely definitive. Being able to palpate distinct fetal parts is also considered definitive. And, while X-ray is historical now, it was once a definitive sign too.
In the third trimester, most of the patient's complaints are simply due to the mechanical pressure from the large, growing uterus. I mean, it's just physics, right? It pushes on the bladder, causing urinary frequency, it pushes on the diaphragm, causing breathlessness, and on the pelvic veins, which can cause edema.
This brings us to our final and very, very crucial topic. How do we clinically track this growth? Well, the most common method we use is measuring the fundal height.
This diagram here beautifully shows the journey of the uterine fundus. At 12 weeks, you can just about feel it above the pubic symphysis. By 24 weeks, it reaches the umbilicus. It keeps on rising, and it reaches its highest point at 36 weeks, right up at the xiphisternum. This progression is both predictable and, well, it's measurable.
Now, here is a golden rule for your clinical practice, something you must remember. After 24 weeks, the fundal height, when measured in centimeters from the pubic symphysis, roughly equals the period of gestation in weeks. So at 30 weeks, the fundal height should be around 30 centimeters. It's a simple yet incredibly powerful tool.
So what's the point of this measurement? Well, if you find a discrepancy of more than 3 centimeters, or 3 weeks, from what you expect, that's a red flag. It's a signal that something might be off, and your immediate next step is usually an ultrasound to get a much more accurate assessment. So what could be causing that red flag? This flowchart shows you the common reasons. If the uterus is larger than you expect, your mind should immediately think about wrong dates, a twin pregnancy, or maybe too much amniotic fluid, which we call polyhydramnios. And if it's smaller, well, again, it could be wrong dates or something more serious like intrauterine growth restriction or IUGR, or maybe too little fluid, which is called oligohydramnios.
Now here's a fascinating thing that happens right at the very end. At 40 weeks, the fundal height actually drops back down to the level it was at around 32 weeks. So why does this happen? It's because the baby's head descends and engages into the pelvis. This relieves the pressure on the diaphragm, and the mother often feels she can suddenly breathe more easily. This phenomenon is called lightening.
Okay, let's do a very quick summary. These are the high-yield points you must take away. First, you have to master the GTPAL score. Second, always be able to differentiate between presumptive probable and definitive signs. Third, remember the key probable signs, especially Hagar's sign. And finally, that rule of thumb. Fundal height in centimeters should match the week of gestation.
And to finish, I'll leave you with a question to think about. We've discussed so many signs, but which single sign that you can find on physical examination without using any instruments like a Doppler or an ultrasound is 100% definitive for pregnancy? Give that some thought. Thank you for joining this